As investigators, we often focus on the questions we ask and the answers we receive. However, an equally important consideration is the mental state of the person sitting across from us. Every interview requires a certain amount of mental effort. The participant must listen to questions, understand what is being asked, retrieve memories, organize thoughts, and communicate responses. This mental effort is known as cognitive load. When cognitive load remains within a manageable level, people are generally able to think clearly and provide meaningful information. However, when cognitive load becomes too high because of stress, fatigue, emotional pressure, or being overwhelmed by information, the quality of communication can significantly decline. For investigators, this creates an important challenge. A person who struggles to answer, pauses frequently, appears nervous, or has difficulty remembering details may not necessarily be avoiding the truth. They may simply be experiencing a level of cognitive stress that affects their ability to process and respond. There are several physical and behavioral indicators that may suggest a person is experiencing high cognitive load. These can include repeated movement, such as constantly shifting in a chair, tapping feet, or displaying restless body movements. Other signs may include excessive sweating, changes in breathing, or anxious mannerisms such as repeatedly touching hair, checking the time, or engaging in repetitive behaviors. However, it is important to apply these observations carefully. Similar to our earlier discussion on demeanor, these behaviors are not proof of deception. They are indicators that the person may be experiencing stress or difficulty processing information. They should guide the investigator to adjust the interview approach rather than immediately draw conclusions about credibility. Cognitive overload can also appear through changes in communication. A person under significant stress may take longer to answer questions, become confused by detailed information, lose track of the main issue, or provide incomplete responses. They may repeatedly say that they do not remember or that they are unsure, even when discussing information that is not necessarily harmful to them. This is why investigators must be careful when presenting large amounts of evidence or asking multiple complex questions at the same time. Providing too much information too quickly can overwhelm the person's ability to process the information and may reduce the quality of their responses. Cognitive load is not only a concern for interviewees. Investigators themselves are also vulnerable to mental fatigue. Conducting multiple interviews in a single day, reviewing large amounts of evidence, and making important decisions under time pressure can reduce an investigator's attention and judgment. Fatigue can increase the risk of overlooking important details, misinterpreting information, or allowing personal assumptions to influence the investigation. There is also a practical risk known as stenographer syndrome. This occurs when an investigator becomes so focused on recording every word that they stop actively listening. The investigator may capture the conversation but miss important changes in tone, emotion, or behavior that could indicate a need for further exploration. Managing cognitive load is therefore an essential investigative skill. When an interviewee shows signs of being overwhelmed, the investigator should consider adjusting the pace, allowing additional thinking time, or introducing a short break. Silence is not necessarily a problem in an interview. Sometimes, allowing a few moments of quiet gives the person the opportunity to organize their thoughts and provide a more accurate response. For longer interviews, regular breaks are important. If a person becomes extremely distressed, particularly in trauma-related cases, the investigator should have an appropriate exit plan. This may involve changing the topic, pausing the interview, or rescheduling the session to allow the individual time to recover. The goal is not simply to obtain answers as quickly as possible. The goal is to create conditions where information can be provided accurately, voluntarily, and fairly. A skilled investigator understands that the quality of evidence depends not only on the questions asked, but also on the psychological and cognitive conditions under which those answers are given.